Vani Nambudiri, and I'm a first-year student at the Harvard Business School, and one of the co-chairs of this panel, along with my classmate, Sanya Gurnani. We are joined today by 4 panelists, Mr. Anand Shah from Sarvajal, Mr. Kevin Hassey from VisionSpring, Mr. Abeezer Tapia from Embrace, and Mr. Suneet Singh Tuli from Datawind. We will hear more about each of our panelists' background during the course of the session, but each of them has had extensive experience working in the burgeoning Indian social enterprise sector. We will learn today from their experience about the challenges and opportunities of working in this market. Thank you to all of the panelists for joining us today. We are also very fortunate to have Professor Kasturi Rangan serve as our panel moderator today. Professor Rangan is the Malcolm P. McNair Professor of Marketing at the Harvard Business School. Professor Rangan, in addition to his interest in business marketing, is also actively involved in studying the role of marketing in nonprofit management, and specifically how it influences the adoption of social products and ideas. He is additionally one of the founding co-chairs of the Social Enterprise Initiative at Harvard. Professor Rangan's current research is focused on business models that help serve the needs and wants of 4.2 billion people who live on less than $5 a day. Thank you, Professor Rangan, for joining us today. Once again, welcome to the Social Enterprise panel. We're looking forward to a very engaging discussion. Thank you for joining us.
Good morning, folks. One of the big advantages and pleasures of being at the Harvard Business School is that students like Vani, Udri, Sanya, they do all the work, they do all the job. The whole conference that you see both yesterday and today is actually organized and run by them. And faculty like me get the pleasure to come out here and get them to moderate. But really a big hand to our students. So let me start off briefly. As Vani said, we're very, very fortunate to have 4 terrific people on the panel. People who are actually on the ground doing the work. And they once again make it very easy for academics and professors like me to teach about business at the base of the pyramid, because if they did do all the great work, we would have nothing to teach. So we sort of really are like sponges. We go pick up what they do and then go ahead and bring it into the classroom. So thank you very much for the panelists who are here. Since it's a very short 1 hour that we have, the format is the following. I'll very briefly introduce the panelists and the description of their organization. And right after we get through that, hopefully 5 to 10 minutes, we can get into the group discussion itself, and there'll be a lot of time for you to interact with the panel. So let me start off with Anand Shah. So Anand, why don't you hang on to this remote control? Let me tell you how it works, okay? So I'm going to start off with, I'm going to tell you how it works. So this is Anand, right? So he's the founder of this outfit, terrific social enterprise called Sarvajal. Now there are very different models of bringing water to the many poor people. In India, for example, there are 1.2 billion people, out of which 600 to 700 million people probably don't have access to safe water. Many of them might have pipe connections into their homes, but the water is not good, clean water for many reasons. So this is the organization Sarvajal, and what you will find about Sarvajal is that this is more like a B2B business. It's not like getting bottled water in plastic containers and delivering it home to home at a retail level. This works at the level of a community where they have a process, a franchisee, who cleans the water, and the water filtration equipment is provided by Sarvajal, and from that they are able to distribute water to many communities, and at last count, in fact, the 75,000 people a day get water in 150,000 villages and slums. So that's Sarvajal, and you're the founder. Anand, would you like to add something to the very brief introduction of you? You can move the slides up and down. So that
no, I thought that was good.
So it's a very different model, because in India I've seen a lot of retail models. This is like a wholesale model, so we should really hear from Anand what makes this model tick. So sitting next to Anand is Kevin Hassey, who is the CEO of VisionSpring, which is a global organization. Not just India, it operates in many countries. I think 10 or 12, Kevin, maybe you can tell us the detail.
20 in total.
20 countries. Now, the statistic which I might be glossing over, which Kevin can tell us in detail when he gets to it, there are about 1 billion people in the world who need corrective glasses, out of which close to 600 million simply need a pair of reading glasses, that's it. And their vision can improve. Just imagine, people can't see and then give them reading glasses, and lo and behold, the whole world opens up to them. And this is what Kevin Hassey does. He's got a terrific corporate background. Before he came here, he was running Let's Crafters, and there he's done many straight-out brand marketing kind of leadership initiatives, and he's brought all those skills to lead VisionSpring in 20 countries, bringing affordable glasses to millions of people. Kevin, would you like to add something to these terrific slides? You can move the slides up and down.
I think you did a good job as well. We do some work on the business-to-business side and then some business-to-consumer.
Okay, Kevin. Okay, so moving on. And you can see from this little frame, right? The frame is roughly $1.50 to $5. That's the cost of the frame. And they are able to bring the cost down to that level to take care of close to 1 billion people in the world who need glasses. Let's move on to Embrace. Now, Embrace is, I'm particularly fond of Embrace because the CEO, the president, I don't know whether Abeezer is still with Embrace or you're on sabbatical, but Abeezer is an HBS alum, and he had the bad fortune of having suffered me as his professor as he went to the base of the pyramid. It was lovely to have you back, Abeezer. So Embrace, you can see this technology. There are 20 million low birth babies in the world, and 450 die every hour, literally. I mean, this is the telling statistics, and we can do something about it. So in the developed world, most of these babies, we put them in baby warmers, radiant warmers, or incubators. But that's very expensive technology. Costs close to $20,000 to $30,000 just to get it going, and it needs continuous electricity. So what Embrace has done is come up with this technology whereby it's almost like a thermal blanket. If we have technologies where we can carry picnic baskets and our warm food and pizzas on picnics, why can't you bring the same kind of technological innovation to take care of these babies? So Embrace has come up with a technological solution, and that's what Embrace does. Operates from Bangalore. And Abeezer, you want to add anything to what I've said?
No, I think you did a great job. The only thing to add, specifically, like I said, the mission is to serve hyperthermic, low birth weight babies. Specifically, in India, 1 in 3 babies are born low birth weight. Oftentimes, these mothers don't have sufficient needs, so what they do is they'll tie hot water bottles to their babies, or they'll hold their babies over open flames and coals. So this is the goal, is to make a safe and affordable solution.
Thank you, Abeezer.
And just a plug here, if any of you are B school students, definitely take Professor Rangan's Bonds of Pyramid class. Truthfully, there's definitely invaluable lessons I've learned that I was able to apply to Embrace.
Thank you, Abeezer. Thank you for putting that plug. So just give me your bank account number so I put
Okay, perfect.
It will be a donation to Embrace. Thank you. Okay. And last but not least, Suneet Singh Tuli, he and his partner, they founded Datawind. Now, Datawind operates in all kinds of businesses. They are innovators, pioneers. They've taken few companies IPO on the NASDAQ, and they really work on wireless solutions. But this is exactly the point I think Abeezer was trying to make. So here are pioneers in technology who know how to operate wireless, and now Suneet and partner have brought in this technology to the masses of people who don't have access to technology, and that is mainly education. You can take a look at this very compelling chart, close to 1.2 billion people in India, but the compelling statistic is close to 900 million of them in India, right, live on less than $250 a month. That's roughly less than $3,000 a year. So we often think of India and the burgeoning middle class and what it can do. Same thing with China, with Brazil, with Mexico, and with Turkey, and with South Africa, and so on. But only 1/3 of the people in these great emerging markets can afford the products and technology that we're used to getting in the developed world. In these countries too, about 2/3 of them cannot get access to the kind of technologies which we think are changing the world. And that's exactly what Datawind is doing. They brought in a tablet computer at less than $50. That's the cost of the Datawind tablet computer called Akash computer. And that's likely to revolutionize education in India, especially for the 900 million people who are below the $250 a month income level. Suneet, would you like to add anything to it?
I'll apologize for that convoluted chart sort of slide up there, but I plagiarized off of a number of people. The first, on the top left, you see a chart that Sugata Mitra created, which showed that the quality of education deteriorates in direct proportion to the distance from Delhi. Good teachers don't want to go into the rural places. Next to it is a study that showed that there are 220 million kids in schools in India. In high school, dropout rates are at 68%. The number of kids that should be in school is 360 million. And if computing and technology can help solve that, we had to figure out what is the price point. And we found that the inflection point in the US was when pricing of PCs dropped below 20% of monthly income. And if that's the target in India, that means for that 1 billion or so people, it's got to be below $50. And that's what we're trying to do.
Thank you, Suneet. Okay, folks, so with that brief introduction, let me ask the panelists a question. Each of you have brought in terrific technologies for the masses of poor people, not just in India, but these technologies are applicable all over the world. But just because these technologies are brought for mass of poor people, you just can't afford to make the product quality lousy. I mean, poor people need clean drinking water, so the water purification has got to be the same standard as the people above. Same thing with eyeglasses. You just can't give blind poor people poorer glasses than what we people have, like the glass I'm wearing. And the same thing with Embrace, and same thing with computers. How do you manage to provide high quality or good enough quality which addresses the needs of the poor people and yet keep the cost and affordability that these people can approach it? So how do you manage to keep this balance going between high quality yet at the same time affordable price? Anand, let me start with you and then go around.
Honestly, it's a pretty tough challenge. I think that water is one of these things that it's kind of either clean or it's going to make you sick potentially. You can tell what's going to happen by looking at it under a microscope, by looking at it just visibly, by looking at the container that it's sitting in. For us, we've realized that it takes a lot of patience to make sure you find a solution that ensures that water is clean at the end of your process. So when it gets into someone's house. I have to tell you that we're not always perfect at it. Our franchisees, which sell the water, sometimes they do things that contaminate water after we sell it to them. And they process it, they mix it with water so they make more money, whatever that might be. And we've caught them doing all kinds of things. But what we have learned is that in this world right now, technology has incredible capability of controlling these things. So we use remote monitoring systems that we've had to build in-house that monitor water quality as it's produced, water quality as it's sold. You saw a picture on the screen of a water ATM that we've built that allows us to control quality of water at the point of sale. We know whether it's working or not. We know what the quality of water is at the point that someone comes to get it. The last mile for us is figuring out how to make sure people manage quality of water in containers that they store it in after they take it from our ATMs. That's a tough task. It's a behavioral change thing. I think that behavioral change for us, what we've learned is you have to look at it in the same way that you look at behavioral change in the West. It needs incredible amounts of world-class marketing in terms of what the idea is, why this is good for you, why this is something that you want to spend your money on, your time on, change your practices on. And that's beginning to work, but it takes a lot of time in the field. So, in the service that we provide, which is different from selling products, there's a whole bunch of points of failure, and there's always a sort of balance that you're striking, but I think there's creative, imaginative opportunity in terms of using technology, in terms of using practices, in terms of putting processes in place, in terms of marketing that make a difference.
Kevin Hassey from VisionSpring. I think this has been a journey for us. We historically started with glasses that we were extremely proud of, that had incredibly high quality, and we would say would last 10 years or more to the person who got those glasses. And the only issue with that is they tend to cost more, and the ability of people to buy those glasses is more modest, and you end up selling less glasses and helping less people. What we have realized over time is that we want to be the best quality for the money that people can afford to pay, and impose upon ourselves some professional standards that say, we know the quality it is, maybe it is going to last 3 years, 4 years, 5 years, maybe it's not going to last 10 years, but for the person who doesn't see well and needs to see well, moving them into that journey of just being able to see more clearly in the productivity that they can achieve by seeing more clearly is the most important step. And so we spend our time a whole lot on cost. Reading glasses can be an enormous improvement for many people's lives. We target pennies are really important in that business. About 48 cents is what we want to pay for a pair of reading glasses. If it's prescription glasses, we don't want to pay more than $1 for the lenses. People probably have perspective around the United States of paying $500, $600, $700 for a pair of glasses. We literally operate on cents and really are mindful that we're competing for people's with other needs that they have, which are really significant, and we just want to have a very cost-effective but quality product, and it takes much of our focus and energy to be able to strike that balance.
Thank you, Kevin. Now, Abeezer?
Sure, I think in healthcare, it's really interesting because quality means something different. In healthcare, you can't compromise clinical safety, clinical efficacy, just to have certain quality metrics. I think in healthcare, it turns out to be a lot of times, especially for a medical product, what additional bells and whistles you add and not add. So for every bell and whistle that you add, you're going to have an increase in your BOM, or increase in overall manufacturing price, which either means less margins for you, or you need to increase your price. So you need a fine balance, as was mentioned before. And I think one of the things that Anand mentioned is, what I feel very passionate about is how do you find this, is to get out in the field. And you really need to get out in the field and talk to as many customers as humanly possible. What you cannot do is have ivory tower thinking, sit in a boardroom here in Spangler and come up with some really creative ideas on a drawing board and go out there. To really understand customer needs, you have to get out there, and especially in the context of India, where the consumers are, what a consumer needs are probably not intuitive to what you would assume. So I think finding that balance in the healthcare environment is specifically something to focus on.
So can I ask you a very quick question before we move on to Suneet? Because your conception, Embrace's conception of a baby warmer is very different from what you see. You look at an incubator, it looks like a little cradle, it's got all these radiant devices and all that. You folks play a completely different model. Did that happen because of the process you talked about, talk to consumers, talk to people, and then build it ground up? Or did you take a technology that we have and cut costs without ensuring that, by ensuring that the quality also was maintained? Which of the two was it?
Sure, and you bring up a really good question. So this is the whole concept of localized development, right? The power of localized development. So you don't just take a product made for the West, strip it of a lot of features, and sell it at a really low cost point. That is proven not to be as effective. You need to actually look at the Indian consumer in mind and specifically design around those needs. So to Professor Rangan's point is, go in the field, see their needs, create the product, but it doesn't end there. There's iterations. You create your first guess at what you thought the product should look like after you got all that customer feedback. Then you go back in the field and you show again as many customers as possible the product, get their feedback and iterate. And you keep this process till you get something which you think is sufficient to go out to the market with.
Thank you. Suneet?
So I think in this discussion, you've got to separate the concept of quality versus features. You can deliver quality, but you don't have to do feature overkill. The industry we're in, it's very easily measured by the number of megabytes and the number of gigahertz and things of that nature. And perceptions are driven by that. But we realized that the consumer we're going after, all of those, or most of those, were irrelevant. So our decisions were based on, what are the right set of features? Do we need an HDMI port if the customer base I'm going after doesn't have TVs with HDMI interfaces? Those kinds of things matter. While, by today's standards of a $500 device, this may not be powerful enough, but a Cortex A8 gigahertz processor is the same as what the original iPad had. At 512 RAMs, it's double what the original iPad had. So for a customer base that may have an income level of $150, $200, it's good enough, and it's pretty good. I have a mentor, a guy by the name of Vinod Ham, who was considered the father of the Pentium. And he said, when we put out the first 100 megahertz processor, we had serious discussions if this would kill the PC upgrade cycle. Because we couldn't figure out why anybody on Earth would ever need more than 100 million cycles per second of instructions on their desktop. So bad engineering is why a 1.4 gigahertz quad-core processor shows up on a desktop, and we complain that it's too slow. The fact that less than 50 million people in India have computers at home, but 900 million people have access to cell phones is because we've continued to over-engineer and over-design things which we don't think are necessary.
Thank you, sir. But this raises the next question, right? So each of you have come up with very innovative technologies, try to really not focus so much on the features, but quality that can be affordable for the masses. But the second dimension of really getting price and getting affordability is scale. Unless you really get the hundreds of millions of people in, you can bring costs down to such a level that the products become affordable for the masses you serve. So how do you manage to scale in a difficult environment like India? See, we're all proud, we're all of Indian origin, we're all proud of India, and we're all proud of the subcontinent. But it's not a very easy place to do business for social entrepreneurs like you because of political reasons, civil society, many media reasons. So how do you manage to scale in that difficult environment? Any ideas? Any thoughts you provide? Suneet, why don't you go first?
So we should actually be a case study on how not to scale. We got into an industry that in 2011 sold 250,000 tablets in India. And we had no presence in that market. And we thought, well, if we do 10 or 20% of this market, we'd be very happy. Within the first few weeks of publicity around our project, we started generating 100,000 orders a day. Within the first 3 or 4 months, we generated 4 million orders. Inadequate funding, no idea on how to scale to that level, sort of put us in a relatively precarious situation. And the other mistake we made was that we made a commitment to manufacture in India. And that, it just ended up being a mistake. It's not that product cannot be manufactured in India. Nokia makes about 100 million mobile phones a year, manufactures 100 million cell phones a year in India. There's no reason product can't be made in India. But the bureaucracy and the infrastructure requirements just made it so difficult that it made it very difficult for us to scale. Now, from where we'd started, the fact that we placed over 500,000 units for 2 quarters in a row, we're in the top 3 suppliers in India, in the last quarter ahead of both Samsung and Apple, we can be proud of where we are. The reality is we've only placed 500,000 against the backlog of 4 million units. Depending on how the market grows, I think it takes time. And I think that it's important not to sort of exclude yourself into one market, take advantage of global supply chains,
is necessary for scaling. We face all the standard issues with regards to what do you do with the last mile, what kind of specializations do you need at that level for those kinds of deployments. So you start looking at innovative ways of getting to that last mile. We train libraries. We try to make libraries and librarians more relevant to the digital age and try to convince them, we actually try to make them paranoid that the government's going to shut them down unless they figure out what to do with their future. So they better start thinking of technology. So you've got to start thinking of the last mile and take advantage. In our case, we have to take advantage of the global supply chain to start scaling.
Thank you, sir. Any others who want to take on that? Abeezer?
Yeah, just so we didn't have the fortune, that misfortune or fortune, Suneet, to have overwhelming demand in the beginning, have customers pounding on our door. So I mean, if you look at the overall, if you look at social enterprise in India, I kind of look at it as three pieces. You have the localized R&D that we touched on, you have low-cost manufacturing, and then you have rural sales and marketing. And okay, localized R&D, you get some smart people in a startup setting, in the local setting, checkbox, we can do that. Low-cost manufacturing, get some smart people who understand, again, the local, the context there, checkbox, we can do that. Not saying those are easy, but they can be done. The third part, rural sales and marketing, is the biggest issue that we face. And I think a lot of enterprises face. How do you actually do that effectively? And I guess the way we've been approaching it is with pretty diligent, what we call experimentation. Out of curiosity here, who here has heard of or read the book Lean Startup? Any hands? Okay, so a good chunk of you. So this is the only book, so Vinod Kosa is one of our funders. This is the only book he's mandated every one of his CEOs to read. And the quick premise for those of you is, let's say in an R&D context, instead of making that perfect product and getting it out to the field and then seeing what you can do, the concept is make a product maybe at 50% viability, get it out there, get that feedback, come back, iterate, and repeat that process. So that's for an R&D setting, but you can leverage that heavily in a sales and marketing structure. So very structured sales and marketing experience. So what does that mean? That means, say for example, we want to do a text message campaign. So before we approach physicians, we'll blast a certain group of physicians with text messages, and then we'll check those sales close rates compared to our control group. Another one could be a newsletter that we've had. You know, we want to do a touch point. So we want to deliver that newsletter to the physician before we actually go and call on them. So to see if that has any relationship impact. So we compare again those sales close rates to the standard. So again, so just a very systematic way of experimenting with sales and marketing to see if you can be effective. And I guess for us, that's been the biggest challenge to scale, and it's been a pretty methodical way to go about it.
Lovely, thank you, Abeezer. Kevin, do you want to add anything, especially given you truly have a global supply chain, don't you? The way you operate.
Yes, we would say that one of the keys is just, and it's emphasizing your point, is to just be marketing driven. You know, we don't exist in a little world which is just ourselves. We exist in a larger world, not just of social enterprises, but where consumers have many needs for their money, and we have to test and retest, and we find that people not only have a functional need to see better, but they have aesthetic. They're like any other consumers in the world. They want to look good, and so we have to be conscious of what styles people are wanting to have, and it varies across very many different countries. We started at a point in time where we just wanted to basically take what we developed and bring to them. And we brought one style, and it was this Tada movement that said, we have brought you vision. This is what you must wear. And quite frankly, in our business, there are many people who are trying to make single styles incredibly cost effectively, and then have a whole host of poor folks wear the exact same styles. And we see people just wanting very different things, and we work to be a marketplace-driven organization. We think that's probably the key to success, to reaching the masses.
Thank you, Kevin. Anand, do you want to add anything?
Yeah, just briefly, I mean, we have, sort of to build on what's been said here, working at the bottom of the pyramid, particularly in rural, requires an incredible hustle around sales, around marketing. For us, we have service and maintenance. We have to be able to collect money from our franchisees, both of which there's no infrastructure that exists. I mean, other than getting an internal combustion engine repaired in villages, there's not a whole lot else that has an existing supply chain, that has existing training of people, having plumbers who can fix reverse osmosis machines or fix electronics. They don't exist. If you want to be able to get money, most of the people that we work with don't have bank accounts. We don't have mobile payment capability. Like, that means I have to send someone out there 300 kilometers to collect the 10,000 rupees. If I show up one day and they say, hey, come back tomorrow, it costs me another 500 rupees to go tomorrow. So by the time I actually get the money, I've spent more getting it than I was actually going to make ever. The task in scale is really figuring out how to build these things. Until we have shared services that allow us to just distribution, do service and maintenance, to allow us to train people in the field, allow us to collect money, incredible scale is going to be sort of out of reach. What we have learned, however, there are things that have grown in the course of the last couple of years. Telecom is one of them, which is why we pick mobile technology as a way to control and monitor sort of the things that we're doing, because they're available everywhere. The hardware works, the electricity may not always be available, but hey, the cell phone services, they work. So piggybacking on other people and other people's infrastructure, whether that is the MFIs or it's the echo type or the phenotype payment mechanisms, or it's telecom, I think is one way to build some scale.
Thank you, Anand. So at this stage, I think we were incredible story. We can get into a lot more detail on each of these stories, but I think what we heard is R&D has to be really innovative from the ground up. It's not just taking Western technology and stripping off features, but really understanding the needs. And then in terms of manufacturing, to really do lean manufacturing so that you can keep the cost really low. At the same time, you have to address the quality considerations that poor people need. And then the last point was incredible hustle in terms of marketing and sales. Very, very innovative techniques to get there, not just in terms of reaching masses of people, but a lot of collaboration, piggybacking of infrastructure that already exists. So all three levels, great innovation hustle is needed to get the social enterprise done. So that's what we heard. Let me open it out to the audience. Any questions you might have, please keep your questions real questions, no rhetorical questions, because we really want to hear from the four people and dig into their experience. So let's go ahead. Yes, sir.
My name is Sriram. My question is for Suneet Singh on two fronts. One is when Akash came out, there was a bit of PR backlash because the first wave of devices had some restrictions on their touchscreen capability, or at least as the press that covered it said, there's more promise but not yet, or there's potential but not yet fulfillment. From a new device that is entering the market, how did you react to that challenge, and what have you done to sort of regroup and recover from it? And the second one is on local supply chains. There is a lot of foundry capacity that's already there. I mean, I'm an electronics purchaser, and in most folks, you never buy the first generation unless you're a tech aficionado. You buy the one that's 6 months down the line, or then if a new product has come, you buy the last version because that has gone through the product development re-engineering. So, how have you thought about sort of reinventing your own first generation approach for the Akash tablet?
I'm not sure I understood the second question. Was it sort of the same as the first one?
Yeah, so let's stay with the first one.
So the sort of PR backlash, it was semi-expected. We never expected that the tech reviewers and others would stand up and give us an ovation. We were creating a product, we were selling with profit to the Indian government for around $40. But part of the mistake was that the Indian government set the specs on that product in the summer of 2010, tendered it in early 2011, launched it at the end of 2011. So if it was low in the summer of 2010, by the time they launched it, it was considered horribly low. Where we got lucky was that the purchasing entity that was purchasing from us self-collapsed. That they ran into their own issues. And the government then decided to transfer the project to IIT Bombay. And in that transfer, we requested that we get to redefine the specs. So what the government's decided now is that they'll define specs on these products every 6 months and not think, yes, we need to equip 220 million kids with it, and the specs will be defined in a 5-year plan, and so on. The product that first rolled out was Akash 1 based on those specs. What we rolled out commercially, we started in September 2012 with very different specs. And the reaction to that as a result is very different. Abeezer just mentioned this book, Lean Startup, and the concept that you keep on iterating. In technology, we don't consider any of that a failure. You know, we continue iterating and continue improving. We learn from the reaction and we go on to the next level. I do realize that there are many competitors and others that will have a lot of glee in the perception of failure. But I think that that also becomes a strategic advantage to us. Clayton Christensen wrote this very important book called Innovator's Dilemma. And you know, what I learned from it was that it's not disruptive innovation that wins. It's disruptive innovation that the 800-pound gorilla ignores that wins. So the fact that the 800-pound gorilla is going to ignore this, it's not good enough. You know, you got to have at least a dual-core 1.4 gig quad-core processor. And without that, it's not good enough. Allows us to function and grow in that market. So, you know, the second one will be better. And if you want to wait the 6 months, every 6 months there'll be a new version, and you know, each will continue improving.
Thank you, Singh. So next question, yeah.
Good morning, I'm Rajeshri, and my question is, listening to all you guys, I've figured out that starting a social entrepreneurship in India is kind of, given the challenges, it sounds to me has to be more expensive compared to what in a given developed country where everything is in place. So how do you manage to produce something in terms of healthcare, which is very expensive in developed countries like US, and in India to maintain that quality, and given the challenges, you produce a quality product in given that infrastructure?
Okay, who wants to take that question?
I find two distinct ways of going about this. There are some entrepreneurial organizations who start small, they're out in the streets, they're hustling, and they're going to build their capabilities modestly over time. And they want to get to a great place, they envision that great place 5 years from now, and they're going to build 20% of the infrastructure because they're very cost-focused. There's other organizations that say, I actually am going to envision what I want to be 5 years from now, and I'm going to put that organization in place right now. And from the start, I'm going to be great at doing this. The second way just requires a lot more funding than the first way. But different folks opt for the two different paths.
Any other thoughts to that question? Yeah, Vijay, go ahead.
Just one thing that I think I just want to emphasize the point that you are right. It is very difficult to do a social enterprise in India. I mean, I joke with our CEO, Jane, and well, not joke, I tell her she's done a tremendous job. I mean, to do a startup in New York, Silicon Valley, that in itself is very, very difficult. And then you put something in the context of India, just not to fool anybody here, you just have, great ambitions, but with the infrastructure, given the different, cultural backgrounds, given the different, motivational backgrounds of employees, it is a challenge. Just something to keep in mind as you all of you are thinking about different social enterprises. I guess be ready for that. It's not going to be a walk in the park. It's not going to be probably as easy as a startup you can start here in the U.S.
So, but let me ask you, following up on that, there are two founders here, especially for you, Anand and Tuli. It's incredibly hard. The margins are really low. and there are all kinds of issues you have to tackle. What keeps you going and not burning out? Especially if you're a single business like you are. At least Suneet has got a broader platform. He's got a lot of other technological things to play around with. But if you start a single business like this, what keeps you going?
Okay, well, I'll start with that. That's okay. That's me. So the short answer to that is that yes, it's hard, and there is a hustle required, and there are a lot of things that aren't in place, and all of those things. But it's not expensive in the sense of money always, right? The money is available. There are so many people willing to put money behind impact-oriented ventures in India that if you've got a good idea and you've got commitment, you can raise the money. Right? What it is expensive on is creativity and imagination and sort of your willingness to work hard. And that's a really addictive thing. Right? There's something really awesome about India, and I think this is true of other countries as well. Like, the possibilities are endless. Right? You don't have the restrictions of HIPAA and all these things in healthcare. If you want to work in healthcare and you want to start working on the ground, you can set up an ambulance service and try it and see what happens. Or set up a telemedicine service and see what happens. Right? But the truth is this: if you're willing to work hard, if you've got a solution that you're willing to fail fast and fail off and on, if you're willing to put in the time to get an answer, then there's no better place than developing economies to be able to show that that works. So for me, what keeps me going is knowing that, hey, I've got this opportunity to do something that I couldn't do anywhere else. Right? And I've got support around me to let me prove things that are different from the models that exist elsewhere, but might actually solve a problem that exists everywhere. Right? And that's reverse innovation, if you want to call it that. It's social innovation, if you want to call it that. Whatever you want to say. But the opportunity is phenomenal. And if you thrive on opportunity, then I think this is a place that, is ripe today.
Suneet, do you want to add something to that?
I think what drives you is opportunity. I never thought when we started this that we would become semi-political figures, and people would take exception to what we were doing. We get some very nasty articles written about us on a regular basis, and to us it was unimaginable that people would take it personally. All we're doing is making a cheap tablet. If you don't like it, don't buy it. It should be that straightforward. But when you got a half-page article on New Year's Eve in the New York Times, and the crux of it is that technology and computing hasn't been proven of being value to education, in my opinion, those are faulty arguments. I can give you the names of schools in India and girls' schools and NGOs that use this technology, and they keep you going. The chart I showed at the start is 140 million kids in that country that should be in school that aren't in school. Imagine how long it would take to create enough good quality teachers and buildings and the rest of it to provide an educational system to those kids. So I think it's the opportunity that keeps driving it. And anybody that doesn't believe that computing and internet access is ubiquitous, is going to become ubiquitous, they're naive. And they're going to blink, and 3 years from now, another 2 billion people would have gotten on the internet, and they will say, oh my God, I don't know how I missed it.
Lovely. Next question, please, from the audience. Yes, sir.
Hi, my name is Kapur. My question is probably for Abeezer, a little bit for Kevin. You talked a little bit about rural sales and marketing. So the question is that there are established distribution channels in India for both of your businesses. So did you try to work with them? Did you come up with your own? What was your experience trying to working with those distribution models, and what worked?
That's actually a really good question. That's actually a really big challenge. What are the different distribution models you go through? So we're selling directly to physicians for their clinics, and we're selling to physicians to sell to their patients as well. So we could either go A, direct sales route, or B, the indirect channels that like distributors, dealers. We even look at NGO partners who buy our products and then go on and distribute that as third-party indirect channels. So let's call it direct, indirect. So everything I heard before I joined Embrace from my mentors that worked in Medtronic, the medical device company, all told me, listen, if you want to get financial sustainability, scale, and the reach that you want, you have to go through the indirect channels. That's the only way that you're going to achieve what you want to achieve. So we went out there and we started with a bunch of dealers, and you know what? We weren't successful. So we took a step back and we looked, why weren't we successful? And we decided to invest in a direct sales team, even though it's not in the short to medium term financially sustainable. That's for 3 main reasons. So learn 3 key things. A, for us to learn how to sell our product effectively. B, learn how to service our product effectively and make customers satisfied and build product champions. And third, learn how to create a marketing foundation that can serve the entire premise. And once we learn those 3 things, we look at the direct sales force almost as a marketing expense. You can then take all that and bundle it and pass it on to your indirect channels and your dealers and the distribution channel that you can talk about that already exists, and then hopefully have much more successful results.
Thank you, Abeezer. Next question. Yes, sir, go ahead.
Can you all talk a little bit about governance? Specifically, do you face a trade-off between profit or sustainability and social impact, and what do you do to manage that?
See if this goes in the direction of what we find the regulatory environment in India for us extremely complex, between FCRAs and societies and Section 25s, and not only all those entities as they exist today, but they get changed pretty much on an annual basis, and whether that we exist on the precipice of for-profit, not-for-profit. We actually do a cross-subsidization model where we, on one slide, we literally open retail stores that look very much for-profit, but the only thing we do with that money is each store sponsors a van which goes out to rural India and does a lot of work there. But that confuses people even more. It says, oh my God, you look like no different than a traditional for-profit retailer. And so we find those issues very complex and difficult to manage in India.
Next question. Yes, sir, go ahead.
So my question is specifically to Anand. So I've been working with traditional grassroots non-profits, and I've always wondered, classical non-profits kind of always aspire to kind of get over the weaknesses and bring in efficiency of social enterprises. And social enterprises kind of keep talking about how understanding the consumer is something which, and the scaling up issue. And never I hear collaboration between the traditional non-profits and social enterprises other than the distribution mechanisms, using non-profits as a point of the distribution channel as a source of information being provided by traditional non-profits, because their last mile is their first mile, and the last mile is what social enterprise struggles with, and they struggle with efficiency that social enterprises bring in. And specifically in the context of drinking water and Gujarat, Gujarat has got Seva, Gujarat has got cooperative societies, Gujarat has got International Water Management Institute based out of Anand. There is
The question. What is the question?
Yeah, sorry. So, why isn't that collaborator space not kind of being tapped with potential?
Well, it is being tapped. So the first step is that we work with, and I know everybody else in the space that I operate in works with other nonprofits around sort of advocacy locally, around educating the consumer on recognizing that water is something that you should be willing to buy if the service is something that's provided. We use nonprofit channels, right? However, there are a couple of things. One, we set up as a for-profit for one reason, well, 2 reasons, right? One, I couldn't get talent in the nonprofit space that was equivalent to what I could get in the for-profit space. So if I said I was a for-profit, I got better resumes, right? Number 2 was that my ambitions of scale are significantly different than they were if I was a nonprofit, right? And I'll tell you where we run into this. We've tried to work with nonprofits saying, look, we'll provide all of the know-how. You do this for your community, right? And they say, yes, we do. We want to do this. But they come back and say, hey, in the next 6 months, I want to install 3 of these units, right? My target's to make me viable, I have to install 5 a week, right? 5 a week versus 5 and 6 months. In those 6 months, somebody will write and I don't mean this in a negative way because I come from the nonprofit space, but like somebody we write an annual report that says, hey, we've served 10,000 new customers this year with water, and next year we'll do 5,000 more, and the next year we'll do 5,000 more. Well, the size of the problem is 700 million. Okay? Those 20,000 mean nothing. Okay? And those 20,000, if I work with nonprofits to do them, will take me 5 gazillion years or something like that, if you calculate. Okay? So the issue of working with them is a matter of working with them at a level that's efficient for us and for them. If we can provide something and work with nonprofits and they want to work with us, we do it any day of the week. And we've tried over and over and over and over and over again. And we work with some.
So let me do one thing. Let me turn back to the panelists. The theme for this year's conference, India conference, is India versus India. Local strength versus global growth. So the question for the panelists is, how does social enterprise contribute to this theme? If you have a strong India, then it can also grow in terms of what it can achieve globally. So what are the dimensions of social enterprise that let us accomplish this? We know how it works for industry. If you have a strong India, then it's terrific. The automobile industry, the pharma industry, all those things are great jewels of India. And we have good local strength. We have global growth as well because we export, we do all these things. How does social enterprise come to play? Because social enterprise is inherently a local thing. Or maybe we shouldn't worry about it. Maybe we should just tell the conference organizer it's a poor question for us. Yeah, go ahead.
Just to touch a little bit more on that, I think localized development has a big part in this and what social enterprises can do. So I'll tell you, so we touched a little bit on localized development and the pros of working not in a boardroom in the US and being local. So one of the things social enterprise can do that these multinational companies cannot do localized development. I worked at, like I said, Medtronic, a 40,000 person medical device company. Just recently we have a Bangladeshi CEO who's on board pushing India and China. But you know what? Medtronic, people at Medtronic don't get it. He's starting to make the general managers believe that people at Medtronic just don't understand the concept of localized development. B, they're not structured to do that. They just, the way they're inherently structured now, Medtronic, you take GE Healthcare, take Samsung, they are not structured to make development in a local context the way a nimble social enterprise startup can do that. So I think that's one of the biggest things that a social enterprise can do, build this unfulfilled need that everybody here on this panel is doing that a big multinational corporation cannot do.
Thank you, Abeezer.
So in our case, the hardware is relatively similar in almost all markets. Apart from India now, we have pilots going on in 13 countries, including the US and Canada. And the only thing that's different is that the curriculum is different. As a result, our content partners in each of these countries are different. So if you think of it from that perspective, I don't know that the borders need to exist. All of us that are part of the Indian diaspora, I grew up in Canada. We take advantage of whatever opportunity exists wherever in the world, and while we might customize it for the local markets with local partners, at least to me, I'm not sure the borders really matter.
Anand, do you have a response?
Yeah, so I don't think the borders really matter, but specific to India, if India is going to develop the way that all of us wish it would, it's going to require small and medium enterprise as the engine of growth. They're the ones that create jobs, from 3/4 of the pyramid all the way down. That's where the jobs are going to create in villages, in slums, in small towns, wherever it might be. They're not all going to go work for BMW's factory. They're not all going to go work for Samsung making tablets in India. They're not going to work for any of these guys. And everybody on this panel is doing something that is creative and innovative that helps unlock the value of that market. I think social enterprise, is evolving as a term as well, but is really moving into that, which is innovative types of companies that deliver products and services that a country like India needs to be able to get world class, right? And that means everything. People need healthcare, they need education, they need water, they need energy. And social enterprises are playing the role between the big enterprise that knows how to do this everywhere on the planet, and the government who would like to do everything but can't do anything. That in between, this is what does the work. This is where the cool solutions are going to come from. And those solutions fly around in the south, right? I mean, I don't mean South India, but they fly between sub-Saharan Africa and Brazil and India and China. Like, this is where we're learning from. It's not the water grid in America that's going to get people water in India. It's people figuring out how to deliver water in Bolivia that are going to figure out how to deliver water to villages in India and vice versa. So I think to some extent the borders don't matter, but don't undervalue the need for innovative, socially linked enterprises to get India where it needs to go.
Thank you. Essentially, I think you folks are saying that it creates a whole ecology of what social enterprise might be in a difficult developing country like India, which is definitely exportable. You don't have to export it yourself, but it really brings a lot of good all over the world. So let me do this. We have almost come to the end of our time on this panel. In 5 minutes, we'll have a different panel in this room, but let me give each of you a quick 15, 20 seconds or whatever. What is your advice to aspiring social entrepreneurs who would like to go to India? They could be young people like Vani and Sanya sitting here, or it could be folks who are already on the ground doing some important work. What is your one piece of advice that you would give them? We could start with that. Yes, Kevin, why don't we go with you?
Get in the field, get your hands dirty, learn the business bottom up. You're already incredibly smart and talented intellectually, but nothing can replace that on-the-ground knowledge.
To kind of build off that, to build a successful social enterprise, you're oftentimes going to need a creative business model. To have a creative business model, you're oftentimes going to need a creative revenue model. To have a creative revenue model, you need to understand sales. And one of the things I think even the top business schools in the world don't touch on enough is the importance of sales. And until you really get out in the real world and understand how important that is. So my one piece of advice would be to encourage you guys all to try to get sales experience in whatever capacity you can.
Thank you. Suneet, you want to add your benediction?
I think all I can do is repeat what Kevin said, and that is you really got to get in the field. I remember once seeing an ad in India about a minivan where the driver's seat goes down 180 degrees. And I thought, how dumb is that? Why would they need minivans where the driver's seat goes down 180 degrees? Well, most of those minivans are taxis. Those taxi drivers sleep in them. You can't discover that need sitting from here. You really got to get into this field to understand what the opportunities in that market are.
Thank you, Suneet. Anand?
Yeah, I won't add to that, but I'll tell you this, that no one in this room is likely to fail at anything that they do. 50 years from now, if we look back at each of your lives, you're going to do remarkably well, right? So failure, frankly, isn't an option, right? If you've got the will to do something, if you're willing to put the time in specifically, right? There is no social enterprise that I know of, no one on this panel right here that won't take you. Right? If you said, hey, I'm willing to put in 3 years, I've got ideas, I'll do whatever it takes, they will take you. They're hungry for smart people. If you want to start your own thing, and you're willing to say that I'm going to solve this problem no matter what it takes, that's exactly what the people with money are looking for. Right? They're, every single impact fund is roaming around India trying to find teams that they can back who are actually going to stick it out and solve a problem. Right? And if you're willing to do that, the resources are there as well. So the advice I would have is if you're interested in social enterprise, make a commitment, jump in, go do something, and I promise you, the chances are that you're going to do remarkably well and probably solve a problem the world needs solved.
Thank you, folks. Thank you very much. Thank you for bringing a part of your passion and sharing with us. Thank you for the inspiring work.